Hi everybody, welcome back to my channel. I'm Yesha if you're new here, and today I wanted to make a video about why radiology is a great choice for women or for anybody who wants a family in medicine. I will just preface this video by saying that a lot of the hypotheses about why women don't choose radiology are fueled by not just stereotypes about radiology, but also stereotypes about women and what women are looking for in their career. And I know that that's just obviously nothing is true for everybody, and especially true for an entire gender. I think that's just crazy. But a lot of these hypotheses are driven by oh, women really want human interaction. They want they want the human touch. They want the physical exam portion. They want all these things that are patient-centered. And while that may be true for some people, I don't think it's true for any one specific gender. I think there are men and women alike who would want that, and men and women alike who maybe don't necessarily value that quite as much. So in any case, I just want to preface this by saying that a lot of the hypotheses that exist are based on stereotypes, not just about radiology, but also about women and what women want out of their careers. And I think that's just wrong. And I think a lot of these things were based on surveys and stuff. And while that's all great and valid and true, I think ultimately what it boils down to is a lack of female mentorship in radiology at the medical school level, and also the lack of just exposure in general to radiology in medical school. So in any case, if you are someone who wants a family, who wants to have a life outside of medicine, I'm going to explain why radiology might be a great specialty for you. Which really brings me to my first point, is that radiology is a very flexible specialty. You really have the option to work in a hospital, you have the opportunity to work in an outpatient imaging center, you have the opportunity to work from home. And I would say that even in one practice, you may be able to work from all three of these sites at different days of the week, which I think is excellent and really something that's unique to radiology. And I will say that even before a lot of this COVID and pandemic hit, radiology was already doing teleradiology. We were already having people that worked from home. That was already kind of established, and I would say that the pandemic has really pushed radiology in that direction and has really normalized working from home, at least maybe one day of the week, maybe 2 days of the week, maybe doing certain calls from home, etc. It's really become more normal for that to happen in radiology, and even though it was already kind of established before. So that's really one really nice thing. If you do have a family, if you do need that flexibility, if you do have a child who ended up being sick at home, whatever it may be, you have a dog who got sick, you have a pet, and I think radiology is really well suited for that flexibility, because now you do have the opportunity to work from home. So if that's something that you're interested in, radiology is a really good specialty for you. Not just that, but radiology has great work-life balance. Now, obviously that will depend on what practice you go to, what practice setting, for example, academics versus private practice, but in general, radiology work-life balance is really great. When you're at work, you're working, and when you're home, you're home. And that's one thing that I really appreciate about radiology. It makes it so that you can focus on your work when you're at work and then focus on your home life when you're at home. You don't have to be constantly worried about 3 different things going on at the same time. You really are able to focus on your family, focus on whatever it is that you want to do when you leave the hospital. And so I think that also makes it a great specialty for women, or someone who wants to be more family or home-centered. You might have the opportunity to do that in radiology. The next one is that if you are someone who does want to work with patients, as I said, a lot of the stereotypes are just about how women want to work with patients. I think that you do get that in radiology if that's something that you want. Now, obviously, you have to choose a subspecialty where you would get that, like breast imaging or interventional radiology, for example. But it's there and it's available for you if that's something that you want. You can have that clinic lifestyle, for example. You can have that relationship with patients. You can have that human interaction. And so if that's something that you're looking for, you can find that in radiology. You just have to look a little bit harder. But this is obviously something that you wouldn't know if you didn't do a rotation through radiology and, of course, through breast imaging. But it is there if you want it, the opportunity to have a patient kind of clinic day, for example, or procedure day, etc. That's all available in radiology. So if that is something that you're interested in, having that patient interaction, having that human contact that everyone says that women so crave, then that is definitely an opportunity in radiology, and I wouldn't just cross radiology off your list for that reason. I know that I personally also had the desire to kind of work with women and children. I even considered OB for a hot second, only because of what it entailed, in the sense that I would be doing women's health, and that was something I was personally very interested in. But I did not enjoy my OB rotation. I did not enjoy being in the OR. I didn't enjoy kind of the entire environment that I was in. If you are looking for a specialty that is more surrounded by women or pertains to women's health, you can actually find that in radiology. I'm actually going to breast imaging or women's imaging, but really I think breast imaging is more inclusive because we also do see the occasional male in our breast clinic. You can get that in radiology because breast imaging is an entire subspecialty of radiology. And this is actually something that had me considering kind of OBGYN or even pediatrics. I kind of wanted that women and children thing. I ultimately realized that pediatrics wasn't for me because I wasn't really interested in primary care. And I also realized that OB wasn't for me because I just did not enjoy going to the OR. I didn't like the unpredictable nature, laboring patients, and for me it just wasn't the right setting. When I rotated through the breast center as a medical student, which I was super lucky to be able to do, I realized that that was exactly what I was looking for. It was more predictable and the hours were more predictable. I felt like I had a clinic schedule and I was still contributing to women's health. I didn't have to go to the OR, for example. I was just like, this is exactly what I'm looking for. I can still practice the things that I want to do, but in a much more controlled environment. And so for me, that was really what made me end up applying for radiology, was after I found women's imaging. But yeah, if that's something that you're interested in, that's something you can definitely find in radiology, which I don't think a lot of people know, because unless you, again, rotate through breast imaging, there's no way that you would know that. At the same time, if you are interested in working with children, you can also pursue pediatric radiology. Pediatric radiology is an entire fellowship in radiology as well, and you can either work in a private practice radiology setting where you would probably be reading a mixture of pediatrics and adult radiology, but you can also work at a children's hospital, which is where we did our rotation, and you would be working exclusively with children and reading exclusively children's imaging studies. And so it just depends what you're looking for, but I would say radiology is able to accommodate any of those things, and again, should not be a reason why you don't consider radiology, because you can practice 100% breast health, breast imaging, or pediatrics, or whatever it is you're looking for in radiology. Finally, one of the things that is commonly cited as a reason why women don't go into radiology is because of the radiation. This is not an issue in radiology. I would say that if anything, we are the safest when it comes to radiation exposure. We have the most knowledge, we have the most understanding of kind of optimizing our radiation protocols. And when you are pregnant, or if you are trying to conceive, or whatever it may be, you are able to avoid any direct radiation. So you do not need to fear the radiation in radiology. We are almost never in direct radiation exposure. If you are extremely protected, and we have protocols in place for that. And we also have a badge that measures all of your radiation exposure over time, and those levels are nearly always undetectable. So if the radiation is something that scares you, I would say that just realize that radiologists actually have the most knowledge about radiation. We actually have the best protocols in place, I would say, when it comes to radiation. Even other specialties use radiation, like cardiology, if you're doing interventional cardiology, if you're doing urology, if you're doing orthopedics. I mean, you go to the OR, how often do you see a C-arm in there? You know what I mean? So radiology is not the only specialty that uses it, but I would say we are definitely the most knowledgeable about its use and how to reduce the amount of radiation that you get. And also, our colleagues are really nice and will always step up if you are uncomfortable, if you're pregnant, etc. Even when I wasn't pregnant, I had an attending who told me, like, oh, you don't need to be in here for this. You should take like 5 steps back. You should leave the room because you're young, you're a healthy woman. I don't want you to be exposed to this radiation. So people are very cognizant about the radiation exposure, and I've never had any levels that are detectable. In fact, I can't even remember the last time that I was in direct radiation. It was indirect radiation. Like, honestly, most of our work is done outside of direct radiation exposure. So my point is that if that's something that's scaring you from radiology, come talk to us. I'm always happy to answer questions about radiology over on my Twitter or my Instagram. I try to respond to as many messages as I can. I know that sometimes I can't get back to everybody, but I do my best at Yesha Gupta MD, and I will see you all in the next one. Bye.